Let's head to Murang'a, and the governor, who has a no-show or was a no-show last week for a Senate grilling over the expenditure of COVID-19 funds, appeared today to report how his county has spent the cash. This follows an audit exposing massive irregularities in the use of the COVID-19 funds in several counties. Martin Mora has that story.
Last week, the Senate Health Committee sent away a team of Murang'a County officials sent by Governor Murang'a Governor to answer queries on the use of COVID-19 funds. Today, the governor was available and in a virtual meeting sought to clarify issues raised by the Auditor General on the procurement of COVID-19 items. According to the audit report, the county was accused of spending Kenya shillings 213 million on COVID-19 items without approval of work plans specific to COVID-19 activities. The county is said to have irregularly established county COVID-19 funds and opening 2 bank accounts without following due process.
Transparency is very, very important, Mr. Governor. And so you need to really try to adhere to all the kind of regulations that are supposed to be done in terms of procurements.
The committee temporary chairman, Narok Senator Ledama Olekina, sought to know the source of the money in the accounts and how it will be accounted for.
I think as Senate, you need to fight for governors as far as funding is concerned. We have to be accountable, and that's why we have to subscribe to this process so that we can also be able to justify why we demand funds.
The committee ordered the amount to be transferred to the Consolidated Revenue Fund, CRF. The county also failed to disclose the value of donation in its books, raising concerns that donated items were diverted. Further, the audit established that Murang'a did not utilize Danish International Development Agency funds, frontline health workers' allowances, and the Kenya Devolution Support Program funds amounting to Kenya shillings 100 million. On the financial and non-financial report, it was established that there was a disparity of Kenya shillings 33 million. Mwangi was also questioned on the 300-bed isolation center after the auditor said only 110 beds could be accounted for. On the oxygen supply,
our daily use is about 2025. If we have surplus at any other day, and a neighboring county comes in, then we have an obligation.
Ledama said there was a history of mistrust between auditors and governors, adding that the Senate was not at war with them. The governor was ordered to submit details on the expenditure of the kitty within 7 days. Martin Mora, NTV, Murang'a County.